What is the significance of full face rejuvenation with injectables? We're going to talk about that today. Hi, I'm Dr. Sanjeev Nilogi, founder of Glow Skin Hair and Laser Clinic in Mumbai. Well, coming back to the full face rejuvenation as compared to the indication-wise treatment, we used to do that and patients still ask for individual indication to be treated like nasolabial folds, marionette lines, or the teardrop. But these indications are a combination of various factors on the face. The major problem on the face is the cheek volume loss or a cheek ptosis, which happens with age because of the volume loss from the face. So unless we fix that, going into the areas individually can make it look unnatural. That's what many people think. With injectables, one looks unnatural. But the way we age, the steps of aging, we follow them and treat them accordingly. Treat the cheeks first and then go to the teardrop to make you look fresh. Treat the nasolabials to make you look youthful. Treat the marionettes to make you look happy and less saggy. If you do all that, then it looks very natural. Even if I use a good number of syringes, it won't make you look like you got something done. When we talk about the full face rejuvenation, it involves three parts of the face, that's upper face, mid face, and the lower face. So major is the cheek ptosis, which is the root cause of all the problems. But in the upper face, it's the eyebrows and the eyes, which may look tired, sad, and aged. The reason behind could be the muscle movement, the depressive muscles which are pulling the eyebrows down. So hence we need to put a little bit of botulinum toxin in those muscles so that the raise of the eyebrow happens. But there could be a volume loss in the temples too, which brings the eyebrows down. So we inject a bit of fillers and with combination of botulinum toxin so that it gives you more refreshed and rejuvenated and the eyebrow get lifted and you look fresh. When it comes to the mid-face rejuvenation, many a times the patients ask for the nasolabials to be treated so that they look youthful. But we need to explain them that the nasolabials get worsened with the cheek ptosis, cheek coming down with the volume loss. Hence, it is very, very important that we fix the cheek ptosis first and go to the nasolabials. And in the mid-face, you have the teardrop also, which makes you look tired. And of course, we treat that as well along with the cheek lift, teardrop improvement with fillers, so it makes you look fresh too. For treating the lower face, obviously, the first thing we need to do is the cheek lift. Then individually we assess the lower face, whether they have the oral commissures or the marionette lines, and we improve that. But in Indian faces, we have seen many a times that the chin is deficient. So we need to give projection and elongation to the chin so that they look more harmonized in the lower face too. Many times the patients want lips, they want more, but I see the chin is too small. So it doesn't allow me to do more in the lips unless I do the chin. So the patients understand that, then they go for the chin augmentation, and then the nose, lip, chin, they look harmonized and look better and natural. Stay tuned for such informative videos on the facial rejuvenation. And don't forget to hit the like button and share button. And please do share these videos with your friends and families. Thank you so much.